We have about close to 20 people on the phone lines right now. So welcome to all of you. Thank you for taking your time to just join us, and I hope this is a really good time to help you get prepared. I want to introduce our health policy consultants. Jim Twaddell and Sarah Savoy are from the district policy group with Drinker-Biddle-Reese. And Jim and Sarah are going to take over and share with you a little bit more about the workshop. Sarah?
PowerPoint.
There you go. Sarah?
Thanks, ma'am. This is okay. Jim. Sarah and I are in the same room, so
good morning.
We just want to make sure we have control of the PowerPoint real quick, so I can advance it. Sorry, folks. Just give us 1 second.
We're looking at the picture with your pictures on it right now.
Yeah, I'm sorry. I'm just not able to advance it, Janet. Do you still have control of it?
No. If you put your mouse in there and click right in the middle of the PowerPoint, there you go. Now it's advancing.
So I'm sorry, folks. I advanced this a little too far, but thank you very much for joining us this morning. We greatly appreciate it. What we hope to provide you, as Janet said, is some preparation for your visits. We want to talk to you a little bit about the schedule, the logistics, and more importantly, the content and who's going to be addressing you while you're at the health policy workshop. Our hope is that you walk away from this. What's interesting and slightly different for those of you that have attended this workshop previously or attended some of ANNA's, the annual meeting or other presentations, is that we are going to be very light on PowerPoint. These speakers have all agreed to come. It's free of charge, so we don't charge the speakers or pay the speakers a fee to come. They do it at their own free time, and what they've kind of asked us is that they would prefer to be able to engage in a dialogue with each other as well as with you about the issues, and they find that to be much more effective. And secondly, in the evaluation forms for the previous health policy workshops, we've been asked as best we can to limit the number of PowerPoint presentations. So what you're going to see for the most part during the day is going to be these panels of experts not only having a conversation but also engaging you and taking your questions. So we have Rachel Meyer from ASN, Katie Schubert from ASPN, and Troy Zimmerman from NKF. It was raised last night on our webinar that some folks know these organizations and some folks don't. Each individual will talk about their organization briefly and talk about their role, so you'll get a sense of who they are, who they work with, who they represent, and the issues that are of concern to those organizations. But what they're going to address is what's going on the Hill in regards to kidney disease legislation, and primarily they're going to focus on Chronic Kidney Disease Improvement Act, Research and Improvement Act, which will be one of the issues you're going to Capitol Hill to discuss. And secondly, they're going to talk a little bit about the immunosuppressive issue. There is not currently a bill that's been introduced on that, so you're going to get some background information on it and a little bit of history. But this group is great. We work with them regularly. They're all Washington-based government affairs representatives, and ANNA has a great relationship with all three of these organizations, and we work regularly with them, and I think you're really going to enjoy what they have to say. Then we're going to move to another panel. Donna Bednarski, again, our consultant to KCP, Rob Blazer from RPA, Kathy Lester from KCP, and my colleague, Kara Gaynor, are going to be on this panel. Kara will serve as a bit of a facilitator, asking some questions and also taking in your questions and making sure that we have a robust discussion about the issues facing the Medicare ESRD program. Many of you who have done this before or have been active in ANNA health policy issues know that for years we have been working on legislation related directly to the ESRD program. And what has changed with the passage of legislation to create the bundle and everything else has happened is that our work with the Medicare ESRD program has changed slightly. We spend less time on legislation related to it and more time on regulatory efforts, meaning going to CMS, Centers for Medicare and Medicaid Services, and talking about how the bundle is being rolled out, talking about the 5-star program, talking about the implementation of new quality measures. That's what this group is going to focus on. So there's not a bill per se that deals directly with this that they're going to discuss. They may mention this chronic kidney disease bill, but primarily they're going to talk about what's happening at the regulatory level in regards to the ESRD program. Again, this is a great group. All of them have a wealth of experience. They will talk about who they represent and their background. They are experts in the field on the ESRD program, and while they all represent different entities, together we all work together in coalition. So I think that you'll find them to be able to answer most or any of the questions that you might have, and I think you'll find them very engaging. All right, so we move from the Medicare ESRD program back to talking about nursing issues. So we're going to have 2 panels in a row on nursing issues. The first one will deal with federal nursing issues, and the second will deal with state nursing issues. As we've discussed, obviously there's a kidney community which is organized under Kidney Care Partners. In nursing, we've been proud to be a part and one of the founders of the nursing community, which is representatives of all the major nursing organizations. So currently 61 national nursing organizations are part of it, including the American Nurses Association. And in addition to that, the representative Michelle Arch from the American Nurses Association, who oversees their government affairs efforts, ANA is an organizational affiliate of ANA. So our members regularly attend events, and some of you may also be ANA members. So both Michelle and Suzanne Miyamoto, who's from the Colleges of Nursing, and Suzanne oversees and is the chief staff person for the nursing community, they together are going to talk about some of the key issues, federal legislative and policy issues facing the nursing profession. 2 of the issues that they're going to discuss are part of the 3 acts that you're going to be taking to Capitol Hill. So as I mentioned, one was the chronic kidney disease legislation. The other 2 are nursing related. The first is funding for the Title VIII nursing workforce programs, and the third is the Home Health Improvement Act, which deals with allowing nurse practitioners to certify home health plans, and a practice issue that's extremely important to some of our advanced practice nurses. So what we'd like to do is, with this group, is again, because there's only 2 of them, allow them to engage in a dialogue about these issues and take your questions, because obviously nursing profession is large, and ANA represents all nurses at all levels. AACN represents colleges of nursing. So they all come from a different perspective, but collectively we've been working very well together for a number of years, and I think that you'll find, and I think you'll be impressed with what organizations are doing to advance issues that are important to the profession. So state nursing issues. While the focus of this health policy workshop is broadly, obviously, health policy and advocacy, we're focusing on federal issues for the most part, because you're going to go to Capitol Hill and you're going to meet with federal legislators. However, I think we could all agree that the majority of issues and practice issues that nurses face are developed and come from the states. So the things that are going to affect your profession the most come out of state legislatures and licensing boards. So both of these speakers, Janet Habler from ANA and Elliot Weiss, who's from the National Council of State Boards of Nursing, are both experts in state nursing issues, and they come, again, from different perspectives and are going to provide an overview of some of the key state issues that are facing the profession. One little caveat here is that both of these individuals, I think, have a wealth of information and a lot of interesting things to share. However, based upon the timing and the schedule that we have, they are going to be one of the shortest panels that we're going to have speaking. And so both of them have agreed that they're happy to provide contact information if you're not able to have all of your questions answered during the session. So I just want to give you that little bit of warning, and both of them are lovely, and I think that they'll be happy to work with you in answering any questions that you might have that they're not able to get to in their presentation. All right, so we're going to move from the nursing issues to discuss the kind of preparation for going to Capitol Hill. And this first group in that area will be 2 congressional staffers who will be making up our staff panel. I'm going to work as a facilitator for that conversation, and I spent a number of years working on the Hill. So this, again, will be a dialogue about what it's like to be a congressional staffer, what they actually do for a living, what their role is in advising their members of Congress on health policy issues, and then more importantly, what makes for an effective Hill meeting. You guys, all of you, are going to be going up to the Hill the next day, and they're going to give you some tips about how you can be effective in delivering your message. They're also going to tell you a little bit about what not to do, which is really important, and they're going to put forth some lessons and some tips to which we're going to put into action in some of our other sessions a little bit later in the day. Both of these individuals have worked on nursing issues and worked on health issues before. They're both very experienced staffers. They're not new to Capitol Hill, and I think that you'll find not only their background, education, and experience, but I think their demeanor and also their messages very informative. All right, so following that, we're going to take some of the tips that you got from the Congressional Staff Panel, and Sarah and I are going to do a full-on Capitol Hill prep session. Now, this will be a PowerPoint presentation and will include not only a little bit of what's going to happen on Capitol Hill, what you can expect, where you're going to go, but it will also, we'll dig a little bit deeper into the content. As I've mentioned a couple of times, you're going to have 3 asks when you go to Capitol Hill. One, a chronic kidney disease bill, the other, funding for nursing education programs, and the third, home health legislation. So all 3 of those have a specific message, and we have circulated fact sheets on these via email, I think, last week, and so there's a fact sheet on each of the pieces of legislation, and there's a fact sheet that gives you all 3 of them on one page. It's called an ask sheet. So all of that, we would love it if you would take a look at it in advance of coming so that you feel prepared. But even if you don't, we're going to go through it, and we're also going to take whatever questions you might have about it during this prep session. So we hope this session will move us kind of away from the content, which is at least half of the Health Policy Workshop, and move us right into getting you prepared for going to Capitol Hill. All right, so following the prep session, we're going to have breakout sessions. And the way this will work is when you arrive at registration, you'll have a name tag, and it will be either a blue or a red dot on the back of your name tag. And that just delineates how we've broken you into groups, and we've done our best to group people from state and or region into the same group, so that in the past we've done kind of state breakout sessions where you're with folks from your state, and based upon feedback and a variety of thoughts, we've decided to kind of divide it up a little bit. You'll hopefully be with people from your state and grouped together, but we're going to divide this out. So half the group will stay in the main room where we are and do a role play breakout session with Lucy, Todd, Sarah, and myself, and that will be us presenting how a Capitol Hill meeting should go, giving you some additional tips and some examples, and having a a small group, if you will, discussion about practicing for Capitol Hill meetings. And then you'll also break into individual groups to help practice and prepare. And since you'll hopefully be with some of the people from your state that you're going to the Hill with, you'll be practicing with the people that you'll be headed up to the Hill with, and that will be, I think, a little bit easier to help you prepare. The other group will be in a side room that we have set up for doing a social media breakout session, and that's going to be done by Dave Walls and Celeste from the ANNA National Office. They're going to talk to you a little bit about Facebook and Twitter, how ANNA uses it for advocacy, how you as an individual could do the same, and in addition, talk to you a little bit about members of Congress and what they're doing. I think it's important to note that what we want to help you with in regards to social media is that some people are fully engrossed in it and a part of it constantly, and some people completely shy away from it, and we understand that completely. But what we want is to just inform you about what's out there. Social media, Facebook and Twitter in particular, are great resources for you to learn about your members of Congress. So it's a great way to actually prepare for your meetings. And it's also a great way to advocate. Oftentimes, as professionals, we go to Capitol Hill every day, and after a positive interaction with an office, we're able to send out a tweet and thank them for meeting with us, and we're able to share pictures, all meant to be positive in nature and meant to advance our issues. So Dave and Celeste are going to tell you a little bit about how to do it and a little bit about, I think, some of the do's and don'ts as well. So what will happen is you'll do half your time in one room, and then you will switch rooms, and you'll get a chance to do both the role play and the social media breakout. It's important just to note, and I think this is in some of your materials, that if you have a laptop, we'd appreciate it if you bring it. The organization obviously doesn't have enough computers to make the social media event happen for everybody, so the more laptops we have, the easier it is for people to kind of sit together and work on the breakout. So just a quick note. So that will conclude. After the following those breakout sessions, there will be a quick wrap-up where we will go over the schedule for Tuesday and take any questions that folks might have. But it's meant, that last little session is just meant to make sure you know what's going on Tuesday. So that brings me into Tuesday, June 23rd, which, again, we will start that morning at 8 a.m. in the same room we were in the previous day, and it's three kind of sessions put into one. And I want to emphasize that I think these are helpful, but they're not at all necessarily mandatory. We're not going to provide you any new content. What we're going to do is answer questions that you might have thought of over the evening. And why I think this is important is because oftentimes someone else will answer a question that you didn't either know the answer to or hadn't even thought of yet. And so during this, we're going to talk a little bit about Capitol Hill, who's going where, and how you're going to get there. We will talk about that on Monday, but Tuesday we're going to spend a little bit of time on it and take questions. Expectations for after the meeting, we're going to talk a little bit about what you need to do, what forms you need to turn in, and what to do in regards to travel. And then finally just have a wrap-up to see if folks have questions or if there's anything else. Theoretically, and this isn't true for everybody, but you will have 9:30 a.m. to 4 p.m. on Capitol Hill. Now, and I'm going to cover this, each individual will have their own personalized Capitol Hill schedule. And for some of you, it might mean that you have a meeting that starts at, right now the earliest would be 9:30, but you have a 9:30 meeting, but your colleagues, some of your other colleagues from another state might not have a meeting until, say, 10:30. So you might have a meeting at 3:45 and somebody else might be done for the day at 2:30. So everyone's going to have a varied schedule. And so we're going to do our best to obviously put your meetings as close together as possible so you can get everything done and you don't have to go back and forth. but the expectation is that you'll be on Capitol Hill for the majority of the day on Tuesday. There will be a debriefing session from 3 to 5, and again, I want to emphasize the fact that it's scheduled from 3 to 5, but if you have a 3:30 meeting, that is not a conflict. You would go to your Capitol Hill meeting. That's why we made this a 2-hour option, which is we would like, whenever you're done with Capitol Hill, to come back to the hotel, back to the same room we were in previously, and to drop off any forms that you need to, say goodbye, and maybe tell us a little bit about your experience. Some people may be needing to rush to the airport or a train. Completely fine. That's why it's not mandatory, but we would really appreciate having the opportunity to just talk to you a bit about it. Last 2013, we didn't have this session, and we heard quite a bit of feedback about it that we needed to really offer this opportunity. So some people might not be leaving until Wednesday. This is a great chance to talk with your colleagues, share your experiences, to inform us about what happened in your meetings, and we think it's also just a great way to kind of wrap up the entire experience of the health policy workshop. So again, that's 3 to 5, and then the entire workshop will end at 5 p.m. on Tuesday. So I do have, again, a few quick notes, and I do want to take the opportunity to open it up to any questions you might have, but my hope is that I'll cover a bit here, and that might answer a lot of your questions. Scheduling. I mentioned that you're going to get a personalized schedule when you arrive at registration on Monday. It's very important to note this. We are asking you to schedule your own House of Representatives meeting. So everyone has 2 senators from your state, and then everybody has a local congressman or woman who represents them in that congressional district. So the staff here at DBR will schedule all of the Senate meetings. You are responsible for only scheduling one meeting, and that's with a person from your House of Representatives. And we've circulated instructions on how to go about scheduling those meetings. If you don't have those instructions, let us know via email and we'll send them to you. If you are running into problems scheduling your meeting, people aren't getting back to you, or you run into any issues, again, email us and let us know. But most importantly, if you book a meeting with your member of Congress or their staff, because it's very important to note that sometimes you're going to be able to get a meeting with a member of Congress, and sometimes you might not be able to. If they are not being responsive to you about getting a meeting with a member of Congress, then you want to ask for a meeting with the Health Legislative Assistant. So it's very important that if you feel like you've tried several times to get a meeting and you're not getting a response, or if they say, I'm sorry, the member of Congress isn't available, then you ask for a meeting with the Health Legislative Assistant. But what's most important is that you tell us. You tell us, I've secured a meeting with Congressman so-and-so, or with the Health Legislative Assistant with Congressman so-and-so, and that you email Sarah Savoy, whose email address is on the slide, and say, my meeting is at this time. So you want to ask for a meeting for Tuesday, June 23rd, and you need to let us know what time you've scheduled that meeting for. Now, one quick note. We want you to take the meeting that they offer, but if they ask you a time preference, we're going to ask you to try to book that meeting in the afternoon if possible. Please do not do a meeting or take a meeting because they can't give you an afternoon time slot. It would just be preferred if you did that. So we're scheduling your Senate meetings, you're scheduling your House meeting. We need to know when your House meeting is so that we can avoid any conflict. You will find out when your Senate meetings are once you get to Washington. And this just avoids having 4 or 5 people from the same state writing to the Senate and asking for a meeting which is going to be about the same issues. So any kind of conflict that exists in the schedule, we will either resolve it before you come to D.C. or we will resolve it with you once you're here. The main issue is that we can only know about conflicts if you share with us when your meeting's booked. So again, this is a key part of this. We really want you to enjoy your experience. And it's not always easy to get a meeting, so if you need help, let us know. But this is something we want to make sure that we get right as we move forward. I mentioned laptops. Comfortable shoes is always a good option. I know that I'm a man and I don't know the pain of walking in heels, but I will tell you that I've seen enough to know that please avoid large heels going to Capitol Hill. It's a lot of walking, and you're going to want to be in the most comfortable shoes possible. I think one other just quick note is that you're scheduled and based upon certain states how you registered. So, for example, if you live in New Jersey but work in New York City, whatever address you gave us for registration, that is the state with which we're setting up your Senate meetings. So if there's any discrepancy in that, the key here is that if there's any confusion, and this doesn't happen for everyone, but happens for a few people, if you have any questions about that, you need to let us know so we can ensure you're with the state that you'd prefer to be with. And our preference is wherever you live, wherever you physically live, where you be voting and registered to vote, it would be the state with which you would be associated. So you might want to just double check that and make sure that you have it correct if there's any confusion. So I think that's it on our end. So let me stop here. And Janet, I know we have a number of people, but if you wanted to line up questions, that would be great. Hello? All right, folks, just give us 1 second here. We're going to see if we can. What?
Hello?
Yeah.
Quick question. I have a quick question.
Sure. Who is this?
You mentioned, yes. You mentioned to bring a laptop. Does that mean that they're preferred over the iPad?
Oh, good question. No, I don't think so. That's a really good point. Yeah, I think the iPad's fine. I think we meant a large enough device. So I should have phrased that, but yeah, I think that's fine. Thank you for raising a good point. I don't know if everyone's off mute or what the deal is, but if you have a question, we're happy to take it. Janet, are you there? Hello? I hear someone on the line. You have a question? Hello? I'm sorry, folks. Apologies. Just give us a second here to figure this out. I want to make sure we answer any questions you might have. I know someone's line is unmuted. Hello? Okay, so folks, I think the lines are open. So if you do have a question, feel free to ask. If you don't, we'll return you to the rest of your day. So, any questions at all from the group? Okay, well, our contact information is provided here on the last slide. Feel free to call or email myself or Sarah. Hello? Feel free to contact us if you have any questions, but we certainly appreciate your participation today and look forward to seeing you in Washington, D.C. June 22nd and 23rd.